Hi, you guys. Welcome back for our daily practice questions. It is day 184, and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one-on-one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit that subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. My website is also linked in the description and it houses all of my resources. And if you're looking to enroll in the upcoming 5-week intensive review, class is August 11th through September 12th, and the enrollment link is in the description as well. All right, you guys, question number one. It states a 67-year-old man with incomplete bladder emptying and weak stream is diagnosed with BPH. What is the most appropriate first-line medication? Is it A, tamsulosin, B, finasteride, C, Cipro, or D, oxybutynin? Take a moment and tell me what you got in the comments, y'all. All right, so I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem of the question states, what is the most appropriate first-line medication? And y'all know, I tell you, when we're looking for a treatment, you need to look and see if they provided you with a diagnosis. In this scenario, they have, and this patient has been diagnosed with BPH. So, with BPH, what is the first-line treatment? And your best answer is A, tamsulosin, aka Flomax, right? All right, question number two. A 45-year-old male presents with fever, perineal pain, and dysuria. The digital rectal exam reveals a tender, boggy prostate. What is the best treatment? Is it A, doxycycline? Is it B, Bactrim for 4 to 6 weeks? Is it C, azithromycin? Or is it D, NSAIDs and fluid only? Take a moment and tell me what you got, y'all. All right, so stem of the question here states, what is the best treatment? So again, I tell y'all, if they're asking for a treatment, you got to run it back and see if they provided you with a diagnosis. And if they have not, then you got to run it back a step further and look at the assessment findings so that you can determine the diagnosis, because we got to know what it is to be able to treat it. So here, a diagnosis has not been provided. So let's see how this patient's presentation is so that we can determine what we have going on. So we have a 45-year-old male who comes in. He has fever, perineal pain, dysuria. Digital rectal exam reveals a tender, boggy prostate. All right, tender, boggy prostate is classic for prostatitis presentation. So now I want you to think about how we treat prostatitis. And so your best answer is Bactrim or fluoroquinolones for 4 to 6 weeks. Because we usually do our Bactrim or our ciprofloxacin for 4 to 6 weeks. So B is your best answer. And then lastly, question number 3, which of the following is appropriate for chronic bacterial prostatitis? Is it A, a 7-day course of azithromycin? Is it B, finasteride only? Is it C, 6 to 12 weeks of fluoroquinolones? Or is it D, surgery? Take a moment and tell me what you got, y'all. All right, and so the stem of the question here, in this scenario, the stem is the question is the stem. So it states, which of the following is appropriate for chronic bacterial prostatitis? And your best answer is C. For 6 to 12 weeks, we're going with the big guns, our fluoroquinolones, right? So when it is chronic bacterial prostatitis, that's how you want to go straight directly there. So your ciprofloxacin for 6 to 12 weeks, okay? All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, Feel free to reach out to the nursing studio by giving us a call at 803-400-6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number 1 at gmail.com. Everything that I offer is linked in the bio, and my website houses all of my resources, and it's linked in the description of the video, okay? But y'all know what to do. Y'all make sure y'all meet me back here. Happy studying. Bye, y'all.